A lot of men are dealing with, quietly, erectile dysfunction and hard flaccid syndrome. What you've probably heard or been told is that either it's in your head or it's just a blood flow problem, one or the other. And if that were the full story, a lot of men would actually already be better, but they're not. In fact, research shows that up to 50% of men between the ages of 40 and 70 experience ED, and that number is actually rising in younger men too. So this is not rare, and it's not just aging. Erections are not just about blood flow. They're actually about communication. So between your brain, your nervous system, your blood vessels, and your pelvic floor, right? And when that communication gets disrupted, that is when things start to feel off. Maybe it's difficulty getting an erection, maybe it's losing it quickly, maybe it's decreased sensation, or that constant tight, semi-rigid feeling that people describe as hard flaccid syndrome. And here's where it gets interesting. What we are seeing clinically and what emerging research is starting to support is that many of these cases are tied to dysfunction in the pelvic floor and surrounding tissues. Not just weakness, but tension, restriction, poor coordination. When the pelvic floor is holding too much tension, it can compress blood vessels and irritate the nerves, that which directly impacts erection quality. So the issue isn't that your body doesn't work, of course it does, it's that the system isn't working together as it was. And this is where a lot of men get a little bit stuck, because first-line treatments like medications don't work for everyone. In fact, studies do show that around 30 to 40% of men don't respond well to common ED medication, which is why so many are still searching for answers and solutions. So then they try to push through it, then they ignore it, and they get depressed and nothing fully changes. I've worked with men who come in and who have come in frustrated, discouraged, just down, honestly just questioning their body. Some avoided relationships, some avoided intimacy altogether. And some were told everything looked fine and normal by their urologist, but it didn't feel normal. And when we shifted the focus from forcing an outcome to actually restoring the entire system, things start to drastically change. We addressed the tissue restrictions in the pelvic floor above and below, worked on pelvic floor coordination, calmed the nervous system. We also improved how their body handled pressure and load. And over time, they started to notice different things. More consistent erections, better sensation, less of that tight, restricted feeling in their body, and the best one, more confidence. Now, there's also a growing conversation around regenerative therapy, like shockwave therapy and stim pod. This is where things get really exciting and interesting. Shockwave therapy uses acoustic waves to stimulate blood flow and support tissue healing at a cellular level. And research shows it can actually help regenerate blood vessels. And it can help improve nerve signaling, involved in erection. So some clinical studies have shown that about 60% of men who didn't respond to medication saw significant improvement with shockwave therapy, and many were able to achieve erections sufficient for intercourse. Other information and data has shown that 70 to 80% of men with ED that's only mild have seen significant improvement when the issue is caught a little bit earlier on. So this is not just symptom management. This is actually working the tissue at the stem cell level. But here's the part that most people do tend to miss. So shockwave therapy on its own is not the quick magic fix. If the muscles are tight of your pelvic floor and surrounding areas, if the pelvic floor isn't coordinating well, and if the nervous system is still in a guarded, sort of hypervigilant state, then you're still only addressing one piece of the puzzle, the symptom piece. And that's why inside my practice at Arancia, we don't treat this as a single symptom. We want you to get a long-term result. So we look at your full system, how your body is holding tension, where it's holding tension, how your pelvis